Hello, everyone, and welcome to our virtual symposium, Spreading Your Wings, Transitioning from Pediatric to Adult Rheumatological Care. This symposium focuses on the challenges of moving from pediatric to adult healthcare practitioners and how to best navigate this transition. I am Dr. Lindsay Springer, a licensed physical therapist, a partner with Kaleidoscope Fighting Lupus, and your MC for today's symposium. I'm so excited because today we'll be hearing from two experts on this topic, Dr. Sharon Dowell, followed by Arnita Roberts-Christie. Dr. Sharon Dowell is a practicing rheumatologist at Howard University Hospital. She is also an associate professor and teaches second-year medical students. Today, she will be sharing her perspective on the transition of lupus patients from pediatric to adult healthcare. We are so excited to have her here with us today. Arnita Roberts-Christie is a registered nurse and patient engagement liaison with GlaxoSmithKline. She is passionate and a champion for those with lupus and their caregivers. She will share her experience and some important tools that can really make a difference in the transition from pediatric to adult rheumatological care. And as always, we'd like to take this opportunity to thank our presenting sponsor, GlaxoSmithKline, GSK, for their continued support of those living with lupus and for making this event possible. So enjoy today's symposium, and now let's hear from Dr. Sharon Dowell.
Thank you for that great introduction. Today, I would like to talk about transitions, spreading your wings and navigating the transition from pediatric to adult rheumatology. Now, the term transition is meant to describe a change, and today we are referring specifically to the change from pediatric care to adult care. It is a difficult time. Both doctors and children become attached to each other over the years they've spent together. There is bonding as you go through the vagaries of life with lupus, and your pediatric rheumatologist has usually been one of the rocks in your life. But it's more nuanced than just the change from one doctor to another. There's a change in expectations as well. The transition is clearly not just an event or a single point in time, but a process of moving from one type of care and one stage in your health journey to another. At the end of this process or journey, you will be expected to make your own doctor's appointments and to keep them, to advocate for yourself when you meet with your doctor as an adult, to be confident enough to ask probing questions, to make your own decisions about medications, and to know about your condition, and to be able to plan for your health and for your future. Basically, you'll be responsible for your own care. We know that this move to adult care can be a problem, and a lot of people have had really unsatisfying experiences. Some have described feeling abandoned or feeling overwhelmed and ill-prepared to cope with managing their condition, and also feeling as if the situation was beyond their control. One study found that only 42% of pediatric rheumatology patients participating in a transition program were considered to have been successfully transitioned to adult care 6 to 8 months later after their first appointment with an adult rheumatologist. So that means that there were 58% of pediatric patients that did not transition well. That's a major problem. People who are transitioning are at risk for more flares and more active lupus if the transition is not successful. In fact, research findings show that patients with lupus have more active disease in the year following the transition period. And because lupus can cause damage if it is not treated, if there's an interruption in medications or monitoring, there can be consequences that are felt for the rest of your life. In poor transitions, young people may become lost in the system. We know that there can be more medication non-adherence, delays in making appointments or just not attending doctor's visits, anxiety and depression, and a poor ability to cope. we know from our own personal experience that it takes time to develop self-management skills. So both pediatric and adult rheumatologists need to put things in place to help with this process, this journey of the transition. You may ask, what can go wrong with the transition? Well, data shows that several things can go wrong. What has become clear is that children living with lupus need to be prepared for that transition, and that doctors need to have a plan in place to make this easier. It is our responsibility to ensure that there's a smooth continuity of care. Several of the national organizations have actually partnered to develop essential strategies to help with healthcare transition, because this is not just unique to rheumatology, but to every aspect and area of health. GOT Transition, the National Center for Healthcare Transition, created a structured process called the 6 core elements of healthcare transition. And I want to go through those core elements with you so that you are aware of what is happening. Additionally, the website also has cool tools and resources for families and children. Given the challenge of transitioning, and we are still trying to improve the process, the American College of Rheumatology, in association with the American College of Physicians, have worked to create a rheumatology-specific transition toolkit to guide pediatric and adult rheumatologists on the transition process. And this is so that patients can navigate this rocky time better. So let's talk about these core elements of transition. One is that your doctors need to have a transition policy, and you should be made aware of this. So your pediatric rheumatologist is asked to have a policy or a statement that they share with you, usually when kids are 12 to 14 years of age. And this will make sure that each child has an idea from early on about when transition starts, when you will have to find an adult provider, and how your doctor or your hospital will help you do that. This way, you start thinking about it from early so that the transition itself is not a complete surprise. They should also have a way of tracking and monitoring their patients. And this is to make sure that they know that you have been spoken to and that you have been made aware of the transition, and that you understand or begin to be curious about the steps you need to take in order to make it successful. So it helps to make sure that you're not lost along the way and that you're getting the support that you need. Third, there is transition readiness. How ready are you for adult care? And do you have the necessary skills? So this is an evaluation that is provided, and it's done usually via surveys that ask you questions like, do you know your medications? Do you know how to make a doctor's appointment? And it's generally based on your answers, you will then get the support you need to improve on these things. And then during this phase, you can then begin to identify what is important to you for the next step, which is a transition plan. Transition planning is the part of the process where you begin to discuss your health goals and begin to prepare to work with an adult rheumatologist. Part of it is to make sure that you begin to set dates to complete certain goals. And this also helps with self-management later in life. And finally comes the actual transition or transfer of care. At this time, it is confirmed that you establish care with an adult provider. Remember that pediatric rheumatologists no longer see patients over 21 years. So at this age, your insurance may change as well, and it will mean that you will need to change your provider. Communication between the pediatric and adult rheumatologist is going to be vitally important in this plan. And oftentimes, your pediatric doctor is encouraged to send a letter to your adult rheumatologist to give a medical summary and to give your medical records. Lastly, there should be confirmation that the transfer is complete and that you have established with the physician. And pediatric rheumatologists are often encouraged to get in contact with you sometime after you've actually left their care, usually about 6 to 8 months later, to make sure that you're doing okay and that you have established care with an adult rheumatologist. So as you can see, there's a lot of preparation that's occurring before you actually reach the adult rheumatologist. Now, each child has different needs, so the steps outlined here may be tailored to a child's needs in terms of when each process starts. We also know that young adults of lower socioeconomic settings, who may have poor social support or lower educational levels, may be at most risk for poor transition to adult care. And because of this, they may need additional support. So you should be aware that this is a really important time for you, and your doctor should be talking to you about it if you are in that age range. If it's not happening in your clinic or in your child's clinic, then you need to ask about it. But what is the role of the adult rheumatologist? And what should you expect when you transition to adult care? So we expect you to know yourself, to be autonomous in your decision making. Our visits tend to be shorter, more focused on the medical issues, unless you bring something up. And this is opposed to the pediatric rheumatologist, who may probe more about other aspects of your life. And then you should know your rights. You have the legal right to refuse care or medications or procedures. You will have to give legal consent to share your information with your parents or with your family members. So you get to decide whether you want your parents to be in the room or not, or to know what is happening with your health care. You can also legally sign consent forms for procedures. So I will not ask to discuss with your parents or other trusted person unless you ask me to. And this may contrast with what the pediatric rheumatologist may do, where you may be more accustomed to having that sort of group decision making with your parents or a trusted caregiver in the room. So what can you do in this whole transition process? So we've already told you about how much is happening behind the scenes if the pediatric rheumatologist, and what the adult rheumatologist is doing to prepare themselves for you. But what about you? How can you make this process go easier? According to the Young Person's Guide, which I looked up on lupusuk.org, there are a few things that may help you in this next stage of your life. One is educating yourself about your condition and your treatment so that you can make better decisions about your own health care. Start to take more responsibility for taking your medications and for requesting prescriptions. Understand how to manage money and create a budget. And here I would also say you should also try to understand about insurance and make sure that you take your insurance and ID cards with you to your doctor's visits. Keep important phone numbers on your phone for your doctor, for your nurse. Start to take responsibility for remembering your appointments and put these dates on your phone as well. There are also some really cool apps out there that help you to keep track of medications and doctor's appointments. Look into those. Practice asking questions yourself when you go to the clinic from now. Perhaps you can write them down or make a note on your phone, and when you go to the doctor's office, try to ask a question or two. Try spending a few minutes talking to your doctor in the clinic without your parent or your caregiver in the room. See if you can bolster your sense of independence when you do that. Find out who you should contact if you require help urgently or in an emergency related to your lupus. And then, most of all, let your pediatric doctor and team know what help you feel you may need as you move on to adult services. Let them know as well when you feel ready to make that transition. It would also be good for you to know that having a supportive community of like-minded people can help you along the way. Patient support groups provide understanding, provide tips, and provide additional knowledge. So consider joining a patient support group as you tackle this transition process. I hope this was helpful. I'd like to thank Kaleidoscope Fighting Lupus for the work they are doing to raise awareness about these important topics in lupus. Thank you.
Thank you, Dr. Dowell. You have really provided some helpful information that will make this transition easier for many to navigate. And now we will be hearing from Arnita Roberts-Christie. Welcome, Arnita.
Thank you, Lindsay, and thank you to Kaleidoscope Fighting Lupus, the Executive Director, Tori, and the entire Board of Directors for this opportunity. I am so excited to be here. I am Arnita Roberts-Christie. I am the Patient Engagement Liaison for Us in Lupus with GlaxoSmithKline. Today we'll talk about what's it like to be a person living with a long-term or chronic disease. We'll talk about what that means. And then my goal today is to educate you, the lupus warrior, your friends, your family, your caregivers, your entire village about how you can use the Us in Lupus resources to help you along this journey. And indeed, this is a journey. It's not a one-stop thing. You're on this for a lifetime. What I also want to say is to remind you that although I'm a registered nurse, this presentation does not take the place of you having a conversation with your healthcare provider or your practitioner. What we'll cover today is really in 4 or 5 different sections. We'll talk about education, the importance of you, the warrior, your family members, your entire village is what I call you, to be educated about the disease of lupus. We'll talk about your lifestyle, how lupus impacts it, and how you can play an active role in that impact. We'll talk about communication. There's a very, very important communication, not only between you and your family members, but also between you and your healthcare practitioners. Understanding your healthcare practitioners as part of your team. You are the quarterback and they're part of the team. How can we make that team give you field goals all the time to make sure that you're getting the best possible care at the best possible time for you? Every patient that is diagnosed with lupus is different. We want to make sure that you understand that this is an individual process. And then I would be remiss if I did not talk a little bit to the caregiver, because not only is the person living with lupus going through this, but you, the caregiver, are going through something as well. So let's start with education. I believe it's so important to lay the groundwork that everyone is on the same page. Understanding more about your lupus, about your condition, and doing your part can help you to manage it, can help you to take active role in it, and to help you as you're going through your journey of challenges. Many people find that when you're more active in your disease process, that you feel more empowered. And what we do know is that knowledge is power. When we talk about a chronic condition, or a chronic illness, what we mean is that it's an illness that cannot be cured, unfortunately, but it can be controlled. And that's a real important difference and distinction to make sure that you understand. Symptoms for a chronic condition or chronic illness can last 3 months or longer, and that's really what gives it that definition. Chronic illness can affect you physically, emotionally, psychologically, and it also can affect you financially. Lupus is a chronic illness. It is a long-term illness that can cause pain and inflammation throughout the body, affecting multiple organs in your body. Lupus cannot be cured, but with assistance, it can be controlled. And what I also want to remind you is that 9 out of 10 people that are living with lupus are women. And so it affects women of childbearing ages. Lupus is unpredictable. And this particular slide is a slide that is showing we have a whole community of lupus warriors that are involved in our Facebook page, and they often type up little anecdotes and statements, and this particular statement says, "Every day is unpredictable," and that is the life of a lupus warrior. Every day is unpredictable. It takes time to accept the realities of a long-term illness. It's not something that you wake up and say, okay, I've got a long-term illness, let's just do this. No, it takes time. And it's important that you are patient with yourself during this time. There is a process of coping with lupus. That process is coping with a chronic illness. You will go through a myriad of emotions. You may feel vulnerable. You may feel confused or worried. You may even feel angry. You may be self-absorbed. You may pull back from people. Understand that these emotions are real. They're nothing to run away from. They are emotions that are saying that this is the human part of you. This is what I'm feeling. But it's also important that you let someone else know what you're feeling. Don't keep it bottled up inside. Let your healthcare practitioner know, today I'm really feeling down. I'm really feeling depressed. You may not call it depression, but you may feel like, today I don't feel like getting dressed. Today I don't feel like going to school. Today I don't feel like taking that exam. Those are real feelings. Sit with that, identify that, and get the additional support that you need. Sometimes people need to talk to their family members. Sometimes you may be living alone. You need to talk to your neighbor. Or sometimes you need to elevate that and talk to a therapist or a psychiatrist. All of those conversations are okay. You have the permission to take care of yourself. Lupus, as known, sometimes I've heard this statement. I was at a walk in New York and I saw a t-shirt, someone wearing a t-shirt, and they had on the front, "You don't look sick." And on the back, the t-shirt said, "And you don't look stupid." I thought to myself, what really is that t-shirt saying? The t-shirt was actually saying that lupus has invisible symptoms that cannot be seen by the naked eye. Those invisible symptoms include sun sensitivity. They include joint pain, muscle discomfort. They include fatigue. And let me stop here and say, your fatigue is your fatigue. No one can tell you how you're feeling. No one should dismiss how you're feeling. Fatigue is real. So understand that and be able to share that. So invisible symptoms are not visible to others. You could have issues that are occurring with inflammation around your heart and your lungs, which may cause you to be short of breath. No one can see that, but you can feel that. You may have kidney issues, something that's called inflammation in the kidneys or called lupus nephritis. Or you may have blood disorders, which can also cause you to be short of breath. What's important about it, lupus symptoms cannot always be seen, but you could feel them in your body. And what is important for us that are around you, your village, is to show empathy for those feelings. Another quote from our Facebook page on usandlupus.com, and if there's one statement that you'll hear me ring throughout this presentation, is to please go and visit the usandlupus.com website. From one of our warriors said, "It is definitely an invisible disease. Through it all, we have to keep pushing." And so it's very common for teens and young adults with a chronic illness to feel stressed, to feel as though they're balancing and trying to juggle so many things. So as a teen, you have the social part of your life that you're trying to juggle. You have hormones that are raging and going all over the place, and you're trying to juggle that. You have, in addition to socialization, you're trying, okay, do I fit in with this friend group or do I fit in with that friend group? Well, what about schoolwork? I've got tests this week, I've got tests this week. As the young adult, you may be starting a new job. There's so much that you're juggling. Know that your lupus will have to juggle with you as you're juggling through those things. Most of the signs and symptoms with lupus are related to inflammation. So lupus is what we call an autoimmune disease. That is where the body's cells do not recognize their own cells. And when that happens, there is something that comes together, and it's like the body starts fighting each other. That fight causes inflammation. And that's where we see inflammation can occur in various parts of the body. It can occur in the brain, it can occur in the heart, it can occur on the skin, and you'll see what we typically call as the butterfly rash, is where that inflammation now rests in the organ, which is the skin is actually an organ. That butterfly can rest on your face, and everyone that sees you will see that butterfly rash. And so when I talk about the socialization, that's something that can be seen, and you'll have to, juggle. How am I going to, do I want to go out today? Do I not want to go out today? How can I make my appearance a little bit different so that I am feel good about when I go out. And that's really, really important. So with all of that, lupus can cause long-term organ damage. It can affect, and as you see on the screen, it can affect your brain. And we're going to talk about a term, lupus fog, in case you have not heard of that term before. It can affect your lungs with maybe fluid around them. It can affect your heart. It can affect muscles, kidneys, and we talked about the skin. So now we're going to move into a different section. We've talked about how lupus affects the body. So let's talk about how lupus works with your body in terms of your lifestyle. And I want to move you to a section in our website. It's called Lupus Thriving. That whole section talks about lifestyle, and it gives you resources and ideas from actual lupus warriors on how you can thrive with this disease. One of the ways that can help you thrive with it is tracking your symptoms. If you've never done that before, there's so many different ways to do it. I encourage you to start simple. That means if you are of the age like me, where I write everything down, have a pencil and paper always with you, in your pocketbook, in your pocket. If you are of the generation of my kids, where everything is, you're typing everything on your iPad or on your phone, your Android or your iPhone, type it in. There's a note section that I'm aware of in your iPhone that you can type down, well, today I didn't feel quite well. And then take a moment and think about what's happening that you didn't feel quite well. Because what those feelings are, they're actually affecting your lifestyle. And so you woke up this morning and you felt a little short of breath. Well, what happened last night? And then what happened prior to you putting your 2 feet on the floor? What happened as you got ready in the morning? What were the things that made you feel not quite well? Tracking your symptoms, as I said, start simple, start small. You could have a calendar on your refrigerator where you could put smiley faces for days that you felt well, or put like a crinkly smile for days you felt, not so good. Or put a downward smile where you said, this was not a great day. Every day will be different for you, the lupus warrior, and every day is different for every lupus warrior. No two people are alike. This is a disease that waxes and wanes. You'll have periods where you'll feel good. You'll have periods where you're not feeling as good. And it's important to track that. Acknowledge that this is not a great day, and that's okay. The important thing, though, is to acknowledge it, to write it down, because that is information that you can take with you into your physician's office, or you can call your pediatrician and say, you know, I've had 4 days where I haven't felt really good. This is what's going on. What can we do about this? So we've talked about invisible symptoms. Let's talk about physical symptoms. Those are symptoms that means that your lupus is active, and sometimes that can be called a flare. So those symptoms can be muscle pain, they can be hair loss. You can have hair loss around the edge, or you can have hair loss like right in the top center. You may notice it as you're brushing or combing your hair, or someone who's taller than you may notice, I see a little something. I can see your scalp. This is your village. This is what helps you to help yourself. You could have vision issues. You can also have joint swelling, pain. You can have fever. These all may indicate to you that your lupus is flaring. Another quote from our Facebook community states, know your triggers. Educate yourself and your friends and family. My husband has been there for me throughout it all. Get a support person, and that's really important. Keep your head up. You are not alone. And that's really important to know. It may feel like you're alone because you feel like I'm the only one going through this. But there is a wealth of people on our Facebook community that you can just type in and just say, I'm not feeling it today, and someone will respond to you. It's a community. It's a family. It's your support system. Let it be that support system for you. As the Lupus Warrior said, understanding your triggers. Why is that important to understand your triggers? Knowing your triggers can know when, if you're in a place where you're in your trigger, that may lead you to a flare. So if you know what your triggers are, you can choose to avoid that. So we are in the midst of a pandemic. There's no question about it. Our lives are very, very different than they were 8 months ago. The stress of it all can be a trigger for your body. And if you're dealing with lupus or not with lupus, if you have a chronic illness, that stress can be a trigger. What also can be a trigger is certain foods that you eat, as well as too much exposure to ultraviolet rays, which come from the sun. Lack of sleep, really, really important, and we'll talk a little bit more about the importance of sleep as you're dealing with a chronic illness. Physical, emotional health, where are you? I've got 4 exams coming up. I've got finals coming up. I'm starting a new job. I have to train a new person. These are all physical and emotional stressors that can also add to a trigger. What if you're not feeling well? What if this is flu season? Or what if it's really hot outside? These are areas where you could become ill. And then, of course, what if you have an injury? Okay, so now I'm going to move into just identifying how do we manage a couple of the triggers that we talked about on the previous slide. How do you manage your stress? Talking to someone about your stress, letting them know that you're feeling a little bit anxious and you need a little help. I like to journal. I like to write down things. And for me, that's a way of releasing my stress onto the paper. But I'm finding a way to deal with it. You may have a different way. So think about that for a moment. How do you manage your stress? Some people may like to light candles or smell different scents that can help them release. Look at flowers, look at pictures. Some people may like to look at water. What is it for you? It's important that you find what's good for you to help you manage your stress. What about nutrition as a stressor? Certain foods are really good for your body and certain foods are not so good for your body. Find out what those are. Find out about having what we call a heart-healthy diet, a diet that includes more fruits and vegetables and not so much fried food. What about managing your sun and your skin sensitivity to sun? Knowing that between certain hours of the day, like 10 and 4, the sun and UV rays are at their highest. I'm not telling you not to go out. I love the sun. I love to go out. But how about let's put on an extra layer of sunblock. Let's wear a big floppy hat. Let's wear longer sleeves or longer pants so that you can enjoy the sun, but also protect your body and protect you from aggravating your trigger. Sleep. I said that we'd talk about it. It is important for the body to be rejuvenated from a long day of just going through your day. And sleep is one of the ways that our body rejuvenates itself. Everyone needs a certain amount of sleep. My amount of sleep may be different from yours, but what's important is that we need restful sleep. Setting the stage to have the restful sleep, decreasing your time that you're looking at the television or looking at your phone about an hour before it's time for you to sleep. Reading, listening to soft music. It's important that you get enough sleep to rejuvenate your body. And perhaps you may need a nap during the day. Take that time to be good to your body. Take that time to give it the rest that it needs. On our Facebook page, you'll find another warrior sharing, anyone with lupus is truly an amazing person, and I so agree with that. My daughter has it, and I am in awe as to know how she handles all the pain and the symptoms. On our Facebook page, again, the usinlupus.com, you'll find information, you'll find quotes, you'll find things that will help you along with your journey. Now we're going to move into communication. I'm communicating with you by talking to you, and communicating with your loved ones, communicating with your healthcare practitioners. Us in Lupus has a section on our website that's called Connected section. And there's also a section on there that's called Children. And we take the talking about lupus in different stage, as young as 7 years old. How do I explain lupus? How do I explain the symptoms that I'm feeling if you're a parent with lupus? How do you explain it to your child or to your niece or nephew? If you are of childbearing age and you have lupus, well, how do I explain to my classmates? How do I explain to my colleagues that I have lupus? I want to tell you a little story. I had, when I was in 8th grade, I had a friend. Her name was Michelle. And we did not know at the time, initially, that Michelle had lupus. And some days Michelle would come to school and she'd look, just like Michelle. And then other days she'd come to school and her face would be almost 3 times its size. And for us, Michelle was our friend, so we didn't think anything of it. And then one day, Michelle's mom called us all over and educated us about what Michelle was going through. And as Michelle's friends, as her village, we learned how to support Michelle as she was going through her challenges. We were Michelle's village. We were Michelle's support system. So I encourage you, don't shy away from sharing what you're going through. Your support system, how you communicate with them, is so critically important. How do you get the conversation started? Well, you can start by saying, I'm having a really tough day. Can I talk to you? Or you could slip someone a note. If you don't want to verbalize it, slip someone a note. But there are so many different ways that you can explain to others about your illness and how to get them involved, how to get them to support you. When I see this picture, I actually think of my son. He is a college student, and today we are able to FaceTime one another. We're able to Zoom one another. But if you are a college student and you're away from home, communicate with your family. Let them see you and you see them. Believe it or not, sometimes when you've had lupus for a number of years, you can't see what your village can see. And I can look at my son and I could say, okay, so what's really going on? And he goes, oh, nothing, Mom. And I look at that picture on that screen and I go, okay, if you're not willing to talk about it, let me know when you talk about it. I'm here for you. And that may be all that a person needs to kind of take a deep breath and begin to talk about it. So scheduling talks can be scheduled or they can be unscheduled. But the important thing is that they do happen. Earlier I mentioned what's called brain fog. And if this is the first time that you're hearing it, understand that it is real. Brain fog is when lupus affects the microvasculature inside the brain. And that can present itself as you're easily confused, or you don't remember something, or it's not easy to put everything together. I'll give you another example. I had a patient who I was giving this lecture to, and she went to the doctor's office and the doctor told her all that they wanted to do, and then the doctor walked out, and then the nurse, walk in. And I said to the patient, so what are we going to be doing? What does the doctor want to do? And the patient just gave me a blank stare. And she goes, I don't exactly remember. Now, someone who doesn't have empathy and who's not, doesn't really understand brain fog may get upset with the patient. I understood, and I said, okay, so let's take down a piece of paper and let's review what the doctor shared with you. If you are going to your physician's offices by yourself, I would encourage you, if you cannot take someone with you, make sure to have a piece of paper and a pencil. Or to make sure, if you're of the younger generation, type it into the notes section. This brain fog is very real, and I want to make sure that you understand it can be the inability to concentrate. It can be where you're not able to put it all together. You may have challenges in remembering. Those are okay. It's real. but having an opportunity where you have something that can help you to remember, you have someone that can help you to remember, that's real too. And I want to encourage you to do that. Of course, I wouldn't keep going without another quote from our Facebook page. It says, "The most difficult part is that people don't understand lupus. You have no idea how good it feels when someone cares enough to educate themselves because they love you and want to support you. It is a very lonely and isolating disease, and it can continue to be lonely and isolating if you don't develop your support system. Brain fog may make you feel a little bit lonely and maybe a little isolated. Develop a method that can help you address that brain fog. You can communicate with words, or you can communicate without words. As a teenager, a lot of the communication I have with my teenager is without words. I look at my daughter and I go, okay, so what's really going on? She goes, oh, nothing. I look at the nonverbals. Nonverbals speak volumes. And your shoulders may be slumped. Your head may be down. You may take a lot of sighs. That's a lot that you're communicating. And those of us that are watching that, that's the nonverbals. That's communicating without words. And that's an opportunity for us to dig a little deeper, to try and find out. You may not be ready to tell us what's going on, but when you're ready, know that we're here for you. Know that you're not alone. So we'll move into the next section, which is called health management. You may have many physicians, many practitioners, where you may have started only with your pediatrician, and now you may be transitioning to someone that's called a rheumatologist. So let's look at your healthcare team. On the slide in front of you, you'll see a number of different practitioners in healthcare. So let's take them one step at a time. Let's talk about a rheumatologist. That is a physician that looks at your joints and your muscles. And if you've been with your pediatrician all the time that you've had lupus, you may be at a point numerically in your age where you're going to transition to a rheumatologist. And you may think, well, wait a minute. My pediatrician knows everything about me. My rheumatologist doesn't know me. Give them a chance. Give them that opportunity to get to know you. If you don't want to verbalize it, write it down and then slip them that piece of paper. Let's talk about your dermatologist. A dermatologist is someone that will look at your skin. A nephrologist, someone will look at your lab work to look at your kidneys. How are your kidneys functioning? A therapist, you may need to talk to someone because you've been saddened for a long period of time. No one has called it depression, but it could be depression. Well, let's get you connected with therapists or a psychiatrist that can help you talk out. They are skilled and trained to help you without judgment, to talk about how you are feeling. Your general practitioner could be your internist or your pediatrician. It could be a physician. It could be a nurse practitioner. You may be going to your OBGYN, someone that's going to look at you as a female internally. You may go to the dentist. Sometimes you may be on medication that may affect your teeth and your gums. Sometimes with lupus, you may develop mouth ulcers. And you'll know that you have one when you're so used to having a slice of pizza, and then you eat that slice of pizza and you get a twinge. Well, that tomato sauce, which has acid in it, can aggravate that mouth ulcer. You'll have nurses, you'll have pharmacists who will help you with your medication. And you may also have a nutritionist who will encourage you to eat a healthy diet, a diet that's rich in nutrients and foods that will help your body get the best out of those nutrients so that it will, together with your lupus, help you to be healthier. So managing your healthcare team, there's always going to be one person that's going to be at the top who's going to help you be that quarterback. And again, that may be your pediatrician or that may be your rheumatologist. And that person can designate as your co-captain or your team captain with you. That person will keep an eye on everything that's going on with your lupus. And they will help you to inform your therapist, your nutritionist, your dermatologist, all of those that are part of the healthcare team. You may have appointments that you will need to keep reminders of, appointments that you may have in this virtual world that we're in. You may have telehealth appointments, or you may be able to go in and to see your doctors. Follow up with them and ask questions. Write them down. Very, very important to write down. You know, oftentimes I know I can be so busy and doing things, and I'll go to the doctor and the doctor walks out of the room and I go, I had 4 more things I forgot to ask. If I had them written down, I would ask those 4 more things. So make sure that you write things down if you're not taking someone with you. In 2015, GSK conducted a survey, and the results were, as you see on the screen, we asked patients that are living with lupus, about 200 of them. We asked 100 different caregivers, and we asked 76 different physicians in the United States. And the question was, what we found is that lupus patients often find it difficult to describe how they are feeling or to describe their symptoms. 61% of patients said they minimize their symptoms when they're talking to their healthcare physicians. Are you part of that 61%? 76% of physicians believe their lupus patients have difficulty communicating their support needs to themselves, to their physicians, and to their loved ones. Are you part of that 76%? So again, making sure that you communicate. And now it's time for another inspiring quote. It says, I was diagnosed in '96. Every day is different for sure. The journey is definitely real, especially when some of your family and friends and coworkers will never understand. So stay strong and be there for one another. This inspiring quote from a lupus warrior is an encouragement to you that every day will be different. No 2 days will be the same. You are not alone, and to stay strong. And so now we're going to move into our final section, and that's about self-care. So I've talked a lot to you, the lupus warrior. I've talked to your village. I want to talk, also continuing the talk, to talk to the caregivers. How do you take care of yourself? You are on this journey with the lupus warrior. So for the parents, how do you take care of yourself? How do you take care of yourself when your child is having a challenging day and you feel helpless? Who do you talk to? Do you talk to anyone? It's important that you do. It's important that you keep a journal. It's important that you share your feelings and get the support that you need. Lupus can't be cured, but it can be managed. And so it's important that as your loved one is on this emotional roller coaster, that you may also be on this emotional roller coaster, and that you get the support that you need. Self-care for the caregiver, self-care for the lupus warrior, self-care for those of you that are watching, on the sidelines, how your friend, how your loved one, how your parent, how your coworker, how your classmate. These are all lupus warriors. How are they self-managing? How are they going through this process? And so you can ask for help. There is no shame in asking for help. None whatsoever. Ask for what you need. Take time out. Take the time to be good to you. Take the time to enjoy your surroundings around you. Take a walk when you need to. This is for the lupus warrior as well as for the lupus caregiver. Exercise. That does not mean you need to go do boot camp, but taking a walk, parking a little bit further away from the grocery store, walking a little bit longer to get in there with your mask on, doing what you need to do to take care of yourself. And as we're coming towards the end of the presentation, another quote from our Facebook page of usandlupus.com. I have an amazing friend that maintains her lupus like a champ. I try to educate myself to know what she deals with. When you have people that love you, and all of us have them, find them who can help support you. Have them get the education so that they can understand your verbal, your nonverbal. They can understand what's happening to you that they can physically see, or the invisible symptoms of lupus as well. You may have lupus, but lupus doesn't have to have you. You are not alone. And the next slide shows you just a few of the QR codes. So if you're looking at this, you can take your phone and hold it up to your screen, and that will take you right to the usandlupus.com website. On this website, and I hope you've been able to see, there is a plethora of information, from talking about nutrition to talking about caregivers to talking about you as the young person with lupus, you as the new person with lupus, you as the person who's had lupus for a long time. How do you thrive as a lupus warrior? How do you thrive financially? How can you get support? Where do you go? There are so many different advocacy groups, and you have one in the organization that sponsored this talk, Kaleidoscope Fighting Lupus. Reach out. Don't feel that you're alone, because you're not alone. You have resilience. Take this one step at a time and be the warrior that we know that you are. I want to thank you for allowing me to share some information with you about how to access the resources that can help you along your journey. Usandlupus.com is here for you. GSK is here for you. Kaleidoscope Fighting Lupus is here for you. My name is Arnita Christie, and I thank you so much for this opportunity.
Thank you, Arnita, and thanks for making the issues and tools for this important time of transition so accessible to all of us. This now brings us to the end of our symposium, Spreading Your Wings, Transitioning from Pediatric to Adult Rheumatological Care. We hope you found this discussion and the resources helpful. A big thank you to our presenters, Dr. Sharon Dowell and Arnita Roberts-Christie. And thanks again to our presenting sponsor, GSK, and to Kaleidoscope Fighting Lupus for both their continued support of those living with lupus. And finally, the most important, a big thank you to you for watching and being with us here today. We encourage you to visit our website, which you can find at kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, event information, and award-winning blog articles. And there's so much more. So thank you for spending time with us today. I'm Dr. Lindsay Springer for Kaleidoscope Fighting Lupus.